As far as testing goes, this is my biggest pet peeve with other doctors because it's really poorly tested. People don't understand how to test thyroid, which I don't get. So I want to start, I'm going to draw a really horrible diagram for you, and hopefully I can show it. So we're going to start with, and this will explain the different hormones that we're going to be testing. So if we start with the brain, I'm going to draw a really poor brain, so don't judge. So our brain, let's see how this works. Can we see it? Okay, except it's backwards, so we'll just go with that. So your brain is going to produce TSH. So again, this is backwards because of video. So your brain is producing, your pituitary gland is producing thyroid stimulating hormone. So that's going to come from your brain, and that's something that is the most commonly tested thyroid test, which we'll see in a second where that goes. So then TSH, as we say, will then go to your thyroid to stimulate your thyroid to make thyroid hormone. So TSH itself isn't actually coming from your thyroid. So just to test TSH isn't really giving you a sense of what's actually going on in the thyroid gland. I hope that makes sense. So then from TSH, here we'll see. So here's my butterfly-shaped thyroid gland. So we have TSH coming from the brain that's stimulating your thyroid gland to produce T4. Again, that's backwards. Maybe I'll learn how to draw backwards and then this would make more sense. But TSH is stimulating the thyroid gland, again, to make T4, which is one of your thyroid hormones. And I'm not going to pronounce it because that's just going to be confusing, but it is one of the most common thyroid hormones in your blood. This sometimes is tested, but not always. So, it's great if they can test it, but a lot of times, again, they're only testing TSH. And then there's a third step. Then that T4 circulates throughout your body and goes to what we call your peripheral tissues, so places like your liver and things like that. And then it gets converted to T3. And T3, even though there's not as much as T4, it's the more active or potent form of the thyroid hormone. So if your TSH and your T4 are okay, but you still feel crappy and no one's tested T3, that might be something to look at, because I've had where TSH is fine, T4 is fine, and then we test T3, and that's actually what's out of balance. And that, like I said, is the more potent form of the thyroid hormone. So that's the one to me that's kind of really important to test and see what's going on. And then just to complete this loop, because it is endocrine system, and we love complicated things. So the way this whole system works is that your T3, and to some extent your T4, then feeds back to your brain saying, hey, we have too much thyroid hormone, or we're good on our thyroid hormone, we can stop making TSH. So there's this, what we call a negative feedback loop. So the higher the amount, in theory, of T4 and T3, it should ultimately lower your TSH, okay? So if these are low, T3 and T4, it's not sending that negative feedback to the brain, so the TSH should be higher. So it's kind of weird. So if we look at TSH, if that number is high, that's not a good sign. So I like it below 2. Versus if the thyroid hormones themselves are low, then that's going to be not a good sign that there's hypothyroidism going on.